presenting on Social Responsive Scale, the second edition, which is also known as the SRS-2. This tool, was created by Dr. John Constantino. It's a widely utilized tool which is used to assess social impairments that is associated with autism spectrum disorder, as well as other social communication disorders. Now, the SRS-2 is especially valuable because it captures a range of social behaviors in both children and adults, helping identify, challenges in areas like their social awareness as well as their communication. Really, this is going to be our agenda. I will be kind of going through more of the introduction, which I just did, the purpose, our target population, the psychometric properties, the domains that are assessed, the administration and scoring, supporting research, as well as practical implication and conclusion. Really, the SRS-2 is designed to measure social functioning and responsiveness by assessing behaviors like social awareness, communication, and motivation. The SRS-2 provides a clearer picture of an individual's social skills. Now, this is crucial because it helps clinicians and educators identify potential social deficits, earlier on, which can enable them, to provide timely support and intervention, which can be very impactful. Now, this tool is intended, in terms of the target population, is intended to be utilized across a broad age range from children as young as 2.5 years old all the way through adults. Now, there are versions for preschool, school age, and adult populations, which are each tailored to age-specific social expectations as well as communication norms. Now, this makes the SRS-2 very flexible and useful in various settings such as schools, clinics, and research environments. The psychometric properties, now in terms of reliability and validity, the SRS-2 is known for its strong psychometric properties. Now, it does have a really high reliability with internal consistency that are coefficients generally above 0.90. Which ensures consistent results across, different population. Now, in terms of the validity, the SRS has demonstrated strong construct validity, meaning it's, effectively measures social impairment as it's intended for, and its sensitivity and specificity are also high, which makes it a reliable screener for autism spectrum disorder when used within its designated population. Now, the topics as well as the subtopics that are assessed, the tool does cover 5 key domains. One is social awareness, the other is social cognition, social communication, social motivation, and restricted interests and repetitive behaviors. Now, together, these areas give a well-rounded assessment of an individual's social abilities and challenges, allowing for a more comprehensive analysis of social functioning. In terms of administration and scoring, the SRS-2 is a 65-item questionnaire. It is filled out by someone who knows the individual well, such as a parent, teacher, or a caregiver. Now, it could take anywhere from about 15 to 20 minutes to complete. The scoring is straightforward. Each response is rated on a scale from 0, which is not true, to 3, almost always true. Now, with a high score indicating greater social impairment, scores are typically classified as normal, mild, moderate, or severe, and the highest score suggests a need for further evaluation. There are definitely supporting research as well. Studies including works by Constantino, Gruber does validate the tool as being reliable and has a strong correlation with symptoms of autism spectrum disorder. Now, there are other research that highlights its utility across diverse culture in distinguishing ASD in general. When it comes to practical implication as well as recommendation, now in practice, the SRS-2 is a valuable tool for early detection and social impairment, especially in education or in clinical setting. Now, since it can be used with a wide age range, it helps practitioners, teachers, and parents understand social challenges and creates that targeted intervention using it alongside other tools. Also provides a fuller picture of the individual's needs. So really, there are some, the references that I did utilize for this, but, in summary, really, it is a powerful, reliable tool for assessing social deficits related to autism and other conditions. Now, it is a strong psychometric properties, comprehensive domains, applicability across different age group, actually makes it a very excellent choice for both early detection and ongoing assessment. So thank you all for watching, and I'm happy to answer any questions within the chat group. But that brings me to the end of my presentation. Thanks.